Christopher, and I will be your moderator for this section. So the topic for this section is how innovations for poverty action uses evidence in policy work. And the speaker is no other person than Olasubomi Obadeyi. Olasubomi is a research and project development manager at Innovations for Poverty Action, bringing a decade of experience in leading development projects for non-profit, government institutions, and universities. In her current role, she leads business development initiatives and manages large-scale research projects. Previously, she oversaw health and conflict-related projects in Nigerian and Zambian offices. She has also contributed significantly to labor and health projects at the University of Cape Town, South Africa. Please join me as I make welcome to the podium, Olasubomi. Thank you.
Thank you very much for the great introduction. So I'm coming from an organization called Innovations for Poverty Action, and we're an international research and policy organization. Has anybody heard of IPA, or Innovations for Poverty Action, before? Thank you very much. Okay, there are quite a few people in the room. Has anybody heard of JPAL before? Yes. So I would say that we are their sister organizations. So we do very similar work, if not almost the same thing. So as an organization, our mission is to discover and advance solutions that improve the lives of people living in poverty. And so how we try and do this is through three strategic ambition pillars. So we try and do this three strategic ambition pillars. The first one is that we try and create stronger evidence. We want to make sure that the body of knowledge has more rigorous evaluations. So more evaluations that have rigorous approaches, so that the evidence can be more or less more concrete. Then the second thing is that we share this evidence strategically. So it's not just enough to create the evidence and have all these research projects, but we want to make sure that it's given to the right people at the right time. And that's something that we really endeavor to do with the policymakers, our stakeholders, and different other key influential people in the sectors that we work in. But lastly, we want to equip the policymakers to use the evidence. So anybody with like an academics background or is very familiar with researchers knows that they use quite a lot of jargon. So things that the common man, the lay person won't understand. And we want to make sure that as we're putting together these sort of policy briefs, that it's as easy to understand as possible. So this slide just goes over our partners and how we'd like to work with them. So in terms of how we work, we typically have about 4 partners that we work with. The first one is academics. And ideally, we want people that are really interested in solving the policymakers' questions, or at least answering them. So that's some of the things that we look out for when we're looking at those sort of collaborations. Then secondly, for implementing partners, we want people that are willing to randomize. So our bread and butter, the main work that we do is randomization, impact evaluations, RCTs, which Tony Lope mentioned very, very early on this day. So we want to make sure that our partners are willing to randomize and do evaluations. That's very important. But also they're willing to accept and use the findings that we have. Sometimes when you start off and you do an RCT, you have this sort of big vision of what will happen. You think that it will have like an impact that is 10% in terms of growth or 20%. But then when you actually implement it, you realize that it might have minimal effects, or sometimes even negative. So you want to make sure that despite the outcome, whether it's good, bad, or minimal, that they're still using that evidence for their work. Then also, we want to make sure that our government agencies commit to using the evidence for their policy. So it's not just enough that we have that sort of commitment from our partners, but we also have it from government agencies as well, to make sure that it moves from evidence to policy. And lastly, one of the most important bits is the people that give us money to do the work. Or we want to make sure that as they're giving us the funds as well to get the work done, that they're committed to using the findings to improve their own sort of ambitions and goals throughout the time as well. So if we find out from a project that we've conducted with our own funds that it was not effective, we want them to actually take that and incorporate that into their own planning and then use their own sort of funds more effectively moving forward. So as an organization, we work across 8 program areas. This includes agriculture, education, financial inclusion, governance, health, peace and recovery, and social protection. But also we work across consumer protection, human trafficking, the intimate partner violence initiative itself, displaced livelihoods initiative, and before the end of the year, hopefully, or early next year, we hope to have a program area in climate change. For the sake of time, I'm going to just go through one example on this slide. But basically, this slide is supposed to share case studies of how we've used impact evaluations and scaled them up so that it can inform policy. So the very first one is one I want to focus on for this presentation. So IPA conducted randomized evaluations in 7 countries for what we call a graduation approach. Who's heard of the graduation approach before? 10 out of 10. You know almost everything. So the graduation approach is a multifaceted solution for a livelihood program. It includes like a bucket full of different components. Sometimes it includes assets, it includes cash transfers, it includes training, a bunch of things that they think is really relevant to move somebody out from the ultra poor area in life and then move them up so that they can have more opportunities moving forward. But it's really time intensive. But what we found out from our evaluation is that implementing this graduation approach in these 7 countries, it was very effective. And CGAP, so this is the consultative group to assist the poor, and Ford Foundation adapted this into 8 other countries. So they saw the results, that it was worth adapting and funding, and moving on to 8 other countries. Just to highlight a few more examples of the work that we have done and how it's been adapted for policy making. The first one is called Dispensers for Safe Water. And it's basically having these sort of chlorine dispensers that allows for women or communities to have access to safe water and for it to be safe for more than 24 hours after it was, after they got the water. So this was initially evaluated in Kenya, and Evidence Action actually took this up and scale this out through about 4 different African countries. So it's fantastic that to hear as of 2019, even though if that's like 5 years ago, 4 million people actually have access to safe water because this was scaled up by Evidence Action. Then I'll focus on the picture on the end, the left-hand side. So the mass norm scale-up in South Asia was conducted during COVID. So a huge problem, and I know that we face this in Nigeria as well, is that it was getting people to wear the masks. Right? So we knew that COVID was spreading, we had to be really careful, wear masks, even if you didn't have COVID as well, just to protect yourself. And this was a huge problem that they were facing in Bangladesh. So they conducted a really large-scale evaluation. They saw that it had really positive effects. And then they scaled it up to India to 4 million people. So they saw the evidence that from that initial impact evaluation in Bangladesh, and then scaled it up to India with 4 million people. And then I can spend like 30 minutes on unconditional cash transfers, because there's so many impact evaluations on its impacts and what it does, but I'll move forward for today. So this is another great example. What we have learned over time is that adapting teaching to the individual level, rather than teaching on the rigid curriculum. So this is rather than just sticking to the fact that if they're in class A or class 1, for instance, they must teach a certain curriculum. Adapting it to the individual level consistently leads to improved learning outcomes. And so based off that sort of evidence that we have generated over time, we've seen this be adapted to 60 million children in India, but also Ghana is scaling this up nationally, and we're exploring scaling this up in Zambia as well. And this is another great example. So in Uganda, we were working with World Vision and the Church of Uganda. And we were trying to scale up and test a program that they call Becoming One. So it's basically faith-based couples counseling designed to prevent IPV, intimate partner violence. And the results demonstrated that the counseling had a positive effect on reducing IPV. So after the results came out, what happened is that the Church of Uganda decided to scale up this program. And IPA still was involved in terms of moving that evidence to policy and helping to scale it up as well. So we helped them in terms of designing the tools, in terms of scaling up the program, training the program leads as well, but just making sure that we're able to translate that sort of evidence that we had generated on a much larger scale. Okay. And then finally, I want to talk about how we use our evidence to work with the government. So a couple of years ago, I think about 2 decades ago now, we started what we call embedded labs. And the first place that we have embedded labs is in Peru. And just to briefly explain what that means, is that we have these engagements or collaborations with governments where we put our own staff, our technical leads into the departments or these government agencies. And they support them over a 2-3 year period to build their skills. So maybe somebody like an expert in consumer protection will go to CBN, support their staff to develop the data analysis skills, and to get to a path where they can independently run their own lab. So what we saw over time in Peru, where we first started, is that after we collaborated with the Ministry of Education to run this lab, the government runs this lab by themselves. So we're no longer fully involved with the Ministry of Education in Peru. The embedded lab, that evidence lab that expects them to create these impact evaluations and rigorous evaluations over time, they're running it by themselves. And since we saw that successful model work in Peru, we've had several other embedded labs over time. We have one in Ghana for social protection. We have one in Rwanda with the Education Ministry. And we actually have one in Nigeria with the Central Bank, as well as with NAPTIP. So just for a few minutes, I want to focus on the work that we're doing in the Nigerian country office. I've spent a lot of time talking about what we're doing in different parts of the world. But that's because the Nigerian country office is relatively new. So we've only been around for 5 years. We only have 12 active projects at the moment. We have 22 full-time staff, but we are working across all the 6 geopolitical zones. Okay. And then in terms of our projects that we have in the last 5 years, we have quite a few in social protection. So thinking about how we can help women affected by HIV/AIDS and provide vocational training, but also one with regards to social and emotional skills for people across 6 states in the country. And then in peace and recovery, we have one with regards to the violence between, or the conflict between farmers and herders. In financial inclusion, we work with the Central Bank of Nigeria, and we're also working with several other partners on this side. And in health, we're working on really AI-related tools on building capacity within our PHCs. So this just gives you an overview of our partners and some people that we have worked with over time. And we're really hoping that by the time the Nigerian office clocks 10 years in existence, that would have had the opportunity to scale up some of these successful projects that we're currently implementing. Thank you for your time.
Wow, that was really quite on time. Please, can you do more to Olasubomi for that? All right, so without much ado, I don't know, I know some of us might have some questions, but before you do that, I just want you to know that one thing about each section is that there is interconnection. Everything speaks about impact. So probably when you will be living here, what should be ringing in your head should be how to make more impact. So do we have some questions? All right, 1. I'll just take like 2 or 3. There will be an fixed hour. Okay, 1, 2. All right.
Thank you, presenter. Your presentation was quite explicit. I want to ask, during your presentation, you made mention of something. I'm really not clear about it. You said that you kind of prepare your curriculum or something, to, adapting teaching to the individual teaching, something like that. So I want to know how do you go about that? How do you do it? Like you adapt the curriculum to individual students, like make it, to be specific to each student. How do you go about that?
Okay. So I think that's a great question. I wish the people that were really involved in that project were here in the room. I can try and take a stab at it, and I think what I'll do after this sort of presentation, if you can meet me during the office hours period in time, we can look at the resources that are available for this. But basically, I think what they had done, and they call it teaching at the right level, right? So they figure out where the child is, they do assessments beforehand, figure out where they stand, and then tailor their curriculum or their teaching towards that. But we can talk about that a bit more after this session. Thank you.
Good afternoon, ma.
Good
My
afternoon.
name is Nuruddin. My question is, how do we as individuals get involved with your organizations? And secondly, does Innovation for Poverty Action act like kind of angel investors? Maybe if someone has an idea or innovation that can alleviate poverty, maybe can you maybe fund the person or produce, make the person produce what he or she has in a large scale? Thank you.
Thank you for your questions as well. So I thought about that as we were having like sort of the sessions over time. I was thinking about how I could like sort of revise my presentation to include some of the things that came up in other sessions, but then I forgot once I got on stage. So your question is very valid. As an organization, we make an effort to work with what we call low and middle income countries' PIs, so principal investigators. So those are researchers that are based in Nigerian universities or African universities, research institutions or think tanks, and they do work across our own line. I'll be very clear that we have sort of a process that we go through, and we want to make sure that we're working with people that understand the work that we do, so that's randomized controlled trials, and that they will follow and adhere to that research design. But if you are a lecturer, a professor, and you work across the program areas that I shared before, so if you work across any of these program areas or any of the initiatives that I mentioned, and you have an idea that you'd like to discuss with us, an idea that you think is innovative, that is prime for an RCT, and that you already have some sense of how it can be sort of scaled up if we get the right partners involved, then we're more than willing to talk to you about it. So during the office hours, I'm happy to chat about our process, what is involved, and how we can support you. Then in terms of funding, that's a tricky question. So I say IPA does both. IPA gets funds from external donors, and we do our work through that sort of way. So we have funds from all sorts of places, including governments, private think tanks, philanthropies, a few other options as well. But also we give funds out. So recently we just did what we call proposals for LMI CPIs. So we just did a call in April, and the finalists would get up to $10,000 to do that work. But that only happens once a year, it just closed. I wish I knew about this event and we tailored it towards this event as well. But when it comes out next year, I'll share it with EA and they'll give it to you as well to apply.
Can you do more and say, join your hands together as Olasubomi take?